It's a very interesting session. It's a global startup competition final round. To just give a heads up on the global startup competition, it's also called G Startup. It's run actually it's run twice a year, once during GMIC Beijing and once during GMIC SV. We have 11 great teams which competed for the semi-final round, and we have 3 top finalists for this round. For this session, I'll be handing the stage to another beautiful and awesome moderator and a great speaker, Sherlyn Lin. She's a VP of Global Business Development from Yomobi. I'll take a leave, and it was my honor and pleasure to be a host for this evening. So thank you so much, and welcome, Sherlyn. Please give a big round.
Stand here. Is this? Hi.
Yeah, exactly.
Thank you. That was a great band. Thank you, everybody, for staying up so late. This is really the highlight of the 2-day conference at GMIC. I'm being introduced already, so thanks to our judges who are left on the stage. They were in the previous panel, many of you have seen. But then let me introduce Hans from CGV Capital, Doug from Goodwater.
Tandem,
I'm sorry. Jawa from Goodwater,
yeah.
right? Okay, I have to try to remember that. So they're going to be judges for this final contest. So these 3 winners were picked up from 11 teams yesterday, and the 11 teams were picked up from hundreds of them. So the rule is that each team will demo for 5 minutes, and then we'll leave about 3 minutes for judges to ask questions. We need to be very precise. I'm going to be so mean that I'm going to cut everybody off, even if the words were up in the air, okay? So we're going to be very, very precise. So without further ado, and our first team demo will be Anli Chun from Sending.io.
My name is Leon. I'm the founder and CEO for Sending.io. It's a real privilege for me and my team to present to you today. So what we do is, so here's my founding team. We're a team of very seasoned professionals. I'm a serial entrepreneur with over 4 startups behind me. And in the last 10 years, we had tons of experience in online marketing and email marketing. We also have a team of seasoned professionals based in China that's helping us with engineering and with operations. So who is Sending.io? What we do is we help game developers to use email to engage and monetize their users. So we're the leading provider of email-based solutions for the gaming industry. Our goal is to help thousands of game developers to use email to manage the relationships, communications with thousands of their most valuable and active users. Given that there's 1.5 billion mobile players worldwide, this is a huge market. So what is the problem that we're trying to solve? I think one of the problems is that game developers spend tons of money acquiring users. They spend up to $8 to download per download for user acquisition. But they will lose about 90% of them in less than 7 days. So if there's a solution that helps the game developers to even recover a small percentage of those users, that translates to millions of dollars. Game developers are also looking to make more money in advertising, but there's just some limits to how much advertising that you can push inside the game without totally destroying the user experience. So with our solution, we can provide significant increase in advertising revenue outside the game without affecting the user experience. So our solution is email. And you may ask, why email? It turned out that email is the #1 engagement and retention tool for companies like Facebook, LinkedIn, Zynga, Kabam. It's widely used on mobile devices. It's sticky. And most importantly, email has great call to action and user response. Here's the real-world results from one of the leading gaming companies here in Silicon Valley, Kabam. They have an in-house email solution that's custom built. So they're seeing up to 7% increase in retention and up to 36% increase in average revenues per user, which is phenomenal. But email is not widely deployed in gaming. And why is that? It turned out that it's not so easy to do email, and it's definitely not easy to do well. So it's expensive to implement in-house solutions, and there's no easy turnkey solutions available on the market today. So with Sending.io, we're about to dramatically disrupt that space. So with our solution, with a few lines of code and some customization using our easy-to-use self-service portal, a developer can get a complete email campaign, email retention and monetization program up and running within an hour. So they'll be able to get a full, what we call a full email lifecycle program up and running to help bring their users back. And with our rewards program, they'll be able to see their advertising revenue increase by up to 50%. So how do we make money? Our retention product is based on a standard SaaS pricing model. We're always going to have a free tier, and we're going to have different pricing based on how many users are in the system. And for monetization, we're providing a 70-30 revenue share. So we launched our beta in March of this year. I think the results are off the charts. We love the results. Our deliverability is above 95%. We're delivering to the primary inbox to Gmail. Our email click rate is between 20 to 38%. And we're increasing the engagement by up to 35% for our games. And we have signed up some of the largest games in China, in Silicon Valley, and some big mobile partners. So I think this is a huge market. It's widely open. And we're seeking funding to help us really capture this industry and be the leader in this space. Thank you very much.
Perfect. Right on time. Thank you. OK, judges?
Quick question. What's the opt-in rate been on the providing the email address?
So when we display opt-in page in mobile games, it's about 30%.
30% of people who see the opt-in
They would stop playing the game
address.
and enter their email address. Yes.
Thanks.
How do you think about making this platform defensible? If you had a competition, if you had a competitor who was better funded than you and came in at half your price, how would you prevent them from taking your clients?
Yeah, I think our price is pretty cheap. So we don't think that this is necessarily a play with pricing. I think companies that are first mover and are really understand the gaming space and provide a solution that's really tailored for the gaming industry, they'll have a huge advantage. And the company that are already deployed has a natural, I think it's harder to replace once you're in, because you're not just an SDK that they can replace anytime. You're actually potentially managing millions of their users' database. So I think, so compared to a lot of email providers out there, I think this domain expertise and this focus on gaming, focus on this industry, I think that's our core advantage.
You mentioned you have a 70-30 revenue split.
What's the question? Sorry.
You mentioned you have a 70-30% revenue split.
Yes.
So you keep 30%?
We keep 30.
Okay, so then you're charging the customer $99 a month?
No, that's just that's example. That's for a retention product. That's for sending email out to bring users back to playing the game. So that's a service that we're going to charge based on users. Monetization is different. Monetization is we're using email reward program to help game developers to make more money outside the game through advertising. So that is completely free. So no matter how many email we send, and that we share 70% of the revenue to the developers.
So for you to hit $100 million US a year in revenue,
yes.
How many paying customers do you need to have?
I think we have to be able to capture thousands of developers. For us, we see our mix to be about 30% of our mix to be large game developers, and we see a lot of potential in the long tail of this business. A lot of indies, a lot of smaller developers.
So I did a quick calculation, assuming that you can get a lot of people using the $99 per month subscription. You keep 30%,
Yeah.
$30 a month, 12 months, $360 a year. Divide that into $100 million revenue, you need about 300,000 paying customers. Does that sound realistic?
I think that's high, but a lot of those a lot of the game developers are going to have much higher mix. And I think there's another revenue potential that I haven't really talked about is
You're
user
off.
acquisition.
Sorry.
Thank you very much.
You're off.
Thank you.
Thank you very much, Lisa. Outstanding IO. Next up, MUrgency. Shafi, this is health related, and one of the top 3 winners, Shafi. Thank you, judges. Those are great questions. Sorry, I have to cut you off, but you can meet him and write a check for him. Okay, Shafi.
Good afternoon. My name is Shafi Mehtar, and I'm the founder and CEO of MUrgency. 10 years back in my hometown in Cochin in South India, my mom choked in her sleep, and my father and I had to rush her to the hospital in the back of the car. She survived by God's grace, but was in ICU for 3 days. Sitting outside the ICU during those 3 stressful days, I asked myself this question: why are there no emergency ambulances, which all of us here take so for granted in India, and especially in my home state, Kerala, which is known for its high health standards? This question led me to quit my job and establish an emergency ambulance service with 1 ambulance in Mumbai in 2004. We now run 1,280 plus ambulances with 6,000 full-time employees, transporting 3.25 million patients and delivering 8,000 plus babies annually inside the ambulances.
Wow.
We are the largest for-profit emergency ambulance company in the developing world, with the world's largest ambulance company, USS Envision Healthcare, as the strategic investor. I also founded Life Supporters Institute, which has grown to be Asia's largest pre-hospital care organization, graduating almost 50,000 plus EMTs annually. Yet, 10 years later today, I feel sad because I've not been able to make even a dent in making emergency response available around the world. The reality remains 6.25 billion people on planet Earth do not have access to emergency response of any kind. Of the 0.75 billion who have emergency response access in the Western world and the developed world, it's getting increasingly delayed and incredibly expensive. WHO estimates more people die every day from lack of timely care than AIDS, malaria, and TB. What can we do about it? We're establishing MUrgency, one global emergency response network, where we are building the largest first responder network on Earth, aggregating doctors, nurses, EMTs, paramedics, first aid responders, and Red Cross volunteers to provide on-demand emergency care, urgent care, and home health care. The 3 simple MVP features are: in an emergency, when the app is triggered, or when the phone has a jolt automatically triggered, it'll inform the emergency victims, close family and circle of the emergency with the geolocation. Second, it'll search for the nearest emergency first responder and connect him or her with the directions to the victim. And third, it'll open a communication channel between the first responder and the victim's close circle of family and friends. Effectively, it encompasses the emergency response cycle into the app. It's a free downloadable and in future pre-installed app for universal adoptability. The business model is freemium model, and the revenue model is transaction-based revenue, subscription-based revenue for corporate employees, retail submodel for high-end assistance to global corporate travelers, and a crowdfunding site, emergency.org, for assisting needy and providing cross-subsidy. What is the market opportunity? The smartphone market is 1.5 billion and growing in 3 to 5 years. 100% of the market will be smartphone. 0.5 trillion in emergency care in US alone. We have tested the concept in India, Dubai, and Israel. We have 60,000 downloads with serious traction in another name because we didn't want to risk the brand name. There is competition, but it's mostly elite subscription-based, targeted at the 1% of the global population. Unlike Uber and Airbnb, who have gone in fighting with everybody and anybody, we have decided to partner with every stakeholder. At the global level, you're partnering with UN, World Economic Forum, Red Cross. And at the operational level, we have the US's largest ambulance company, Envision, Europe's largest ambulance company, Falk, India's largest, Sigitsa, UK's largest, NHS, Israel's largest, Hatsela, and Riders for Health in Africa, already signed up as partners with us. We have an incredible tech team led by 2 University of Cambridge graduates, and we also have the CEOs of top 3 ambulance companies of the world in our board of advisors. We have raised $1 million, and we have inherent defensibility in this business with the network, which will be our strength.
Thank you very much. All right, judges.
So I'm sorry, I missed the product. How does the product work? You have a supply of emergency medical professionals in each geo already ready?
We have 100,000 plus signed up already.
Doctors.
With all, it could be doctors, nurses, EMTs, paramedics,
Got it.
and around 9,000 ambulances signed up through these partners. And when the app is triggered, or the phone has a jolt, it'll automatically trigger, and the nearest responder will respond.
So what's the advantage of that over dialing 911?
So 911 is available only for the 10% of the world population, and 90% don't have it. And also out of the city center and downtown, the average response time for an ambulance in 911 in US is anywhere from 20 minutes to 50 minutes.
I see, okay.
What we believe is that with the wearables in health tech coming along, including all kinds of wearables, at a later point, it could be the wearable could even trigger when the BP goes up, an emergency response, making a first responder available quickly.
Yeah,
Okay.
We have a company called Cuff, where women have jewelry that allow them to push kind of a panic button. But I think if I have it right, you're saying that you then have almost like a private network that is faster in responding and potentially higher quality care when I do push that button?
No,
Is that the
actually,
idea?
what we intend to
Still
do is
not.
we intend to be the feet on the ground for all companies like Cuff. They can, Cuff only have the back end. They don't have feet on the ground. We will have feet on the ground where Cuff, X, Y, Z can plug in with our API.
But Cuff assumes people are just going to use the available infrastructure to deal with the problem. I'm trying to understand, you're better than the available infrastructure because of speed and quality? Is that?
Yes, and there is no available infrastructure for the 90% population of the world right now.
So of your 60,000 downloads right now, which countries?
So we
Are you
tested it in India, Saudi Arabia, and UAE.
So India, how does it work? If someone press the app, what happens?
40
Yeah,
seconds.
so the ambulance actually, or the first responder gets an alert. The nearest person responds.
Right. Why would the ambulance respond faster in your network versus whatever's available today?
You have to understand that there is no response. You have to think outside United States and Western Europe. There is no infrastructure right now to call an ambulance.
So why would the ambulance come? Or who's paying them to come?
Oh, so we have tested transaction revenue where in the ambulance business itself we developed. You have to understand that in a tough Indian market, we made success out of payment available.
I get to be Terminator.
Get in the hook.
Thank you, Shafi.
Thank you.
So crowdsourcing to allow everybody access to emergency or urgent care. Thank you, judges. Next up, Dave of STEMP. There we go.
Thank you. Good afternoon. I'm Dave Whalen, one of the co-founders, 3 co-founders of STEMP. Before I get going, just quick show of hands here. Who's ever been sick? So we have a lot of non-participants. I would say the average is probably about 99% or so. We've all been sick, cold, flu. If not, you've been to the doctor, or your mother's given you a thermometer at some point. The thermometer pretty much has not changed over the past 200 years. It's gone digital, it's gotten a little fancier, but frankly, lots of challenges. They're inaccurate in most cases, and you don't get repeatable results, so you can't tell if something's changing over time. They're single-point measurements, so ultimately, you can't take action based on one data point. Some of the newer ones, they're unwieldy, they're complex, they're tough for a parent with a sick child to figure out what to do. And finally, some of them are really expensive. So we thought about this and said, where's the innovation in this space, and what can we do? And that's where we came in. So STEMP is essentially the thermometer meets the Band-Aid. Very simple. Take the small sensor, pop it into a small adhesive like a Band-Aid, apply it to your body, your child's body, and immediately you're getting continuous temperature readings over days, weeks, up to a month. So immediately continuous and seamless. Huge opportunity here. Again, all three of us have small children, and I've had many nights where my son is sick. My wife or I are waking up in the middle of the night to go to the kids' room, to wake him up, to take his temperature, just to see if something has changed, better or worse. Similarly with elderly and their caregivers. And then on the positive side, couples who are trying to get pregnant, women tracking ovulation, want to check their basal body temperature in the morning. People recovering from illness, and again, frankly, anyone in this room, we've all been there, we all could use a better thermometer. So what we've done is we've taken some very simple but powerful technology, smallest, most accurate temperature sensor on the market, coupled it with a Bluetooth chip with integrated antenna, integrated battery, very small package that again gets coupled with medical grade adhesive, kind of like a Band-Aid. That's tied together with some pretty awesome, very, very simple software. You get results instantly. iOS right now, coming for Android. You can manage multiple users, multiple patches with one app, get customized alerts, and ultimately send the data to your doctor. So when you show up at the doctor, you can prove that you're sick, or take it to your boss and prove that you're sick. We think we're really competitively positioned. There are, if you go to the drugstore, there's these $5 digital thermometers that don't work very well, slow, inaccurate. Frankly, you're better off just guessing your temperature. There are some pretty fancy ones out there, touchless digital, but they're really hard to use and they're expensive. And then there are a few out there that are kind of coupled with iPhones, somewhat like what we're doing, but frankly, we've looked at them, they are complex. One of them literally asks you to stick an iPhone in your mouth, which is absurd, and some of them are very expensive. So we're looking at coming in at a $25 retail target ultimately. Small, fast, simple, continuous, wear and forget. We think it's the best thing that will be on the market. So our launch strategy, we're going to do a crowdfunding campaign that we're kicking off right now. We should have that launching in the first quarter. We're going to be at CES as well in January, and following that, we'll go online on our store, app stores, and Amazon. Ultimately looking at both clinical markets, the distributors that serve the clinical markets, as well as retailers. We'd love to be in the Apple store someday, along with Target. And of course, international. Most kind of exciting, from our beginning, we said we should partner with NGOs, foundations, the research side, and we're in the final stages right now of a collaborative partnership with USAID as part of their Fighting Ebola Challenge. We're waiting to hear what the results are on that, but we could be applying this in Africa within months. Going forward, product strategy, getting someone like Mickey Mouse on there. I did not pay for this right now, so if anyone from Disney is in the audience, you didn't see it. Health kit, other integrations to get data in the right places in other apps. The pregnancy app that I mentioned for ovulation. Kind of a hospital clinical suite, something that we would develop alongside USAID with Ebola. And then ultimately, taking a different kind of sensor beyond temperature in the same kind of patch. We've been bootstrapped to date. We're looking to raise about $1 million right now to get the product to market, build out the sales channels. We've hit all of our milestones to date, and we've been very successful in kind of getting the word out via Plug and Play, where we're part of the accelerator. We're going to be a finalist at this CES summit. And we have a team that brings a background in wearables, technology, aerospace, healthcare, and development. Thank you.
Perfect. Right on time. Thank you. Now, judges.
So can you explain the product a little more? Is there a disposable piece and a electronic piece that charges?
Right.
That's separate? I'm not sure.
Yeah, so the hardware itself, actually pass this around. This is a prototype version, but you can see what the casing would look like as well as what piece of the internal hardware. So the consumer would see that white casing, and basically they would buy that along with, say, 5 to 10 adhesives in a package. The hardware is rechargeable. It lasts about 30 days on one charge with continuous monitoring, which would make sense for Ebola or a woman trying to track her ovulation. And the patches are somewhat reusable, replaceable, and ultimately you'd buy a second package of additional adhesives.
Can you talk a little bit about the vision, what you'll do with the data once you have this product out in the market at scale?
Yeah, so we're looking at this kind of in a phased approach. So right now we see this as a product company, product sales that ultimately will build a bigger and bigger data set. And so individuals can use the data for themselves with their doctors, but over time, if you think about the collaboration, say, with pharmaceutical companies, with consumers, so, does Theraflu work better than Tylenol in lowering your temperature over a day, a week, things like that. So we'll look at partnerships like that. MUrgency that was just up, we've already started talking to them about doing a collaboration where a temperature trigger on our on STEMP would automatically call one of the ambulances.
How much do you plan to charge per unit?
So our vision is to hit a $25 retail price that will be the hardware, and again, 5 to 10 patches. We're not there right now. We've got to hit scale, so we'll probably launch this originally closer to $30, $35.
For 10 batches?
And the hardware, right. And again, given that people are paying, my wife and I paid $150 for a fancy digital thermometer when our son was born. We're coming in well below that.
There seems to be a lot of innovation in the thermometer space in general. Can you comment on why that is at a macro level and how you guys are positioned specifically there?
Yeah, and again, we're excited about that. Part of it is everything is getting smaller, right? So this technology, frankly, wouldn't have been possible a couple of years ago, and even in the course of our development over the past year, the chips have gotten smaller, faster, better, and so there's the ability to do this coupled with this entire Internet of Things movement where we want to have sensors everywhere measuring things, and we look at this as one sensor for your body that would be, it's a complement to something like a Fitbit, and it's a complement to other sensors that might be around the house to help you with your health care or just overall well-being.
5 seconds.
How easy is it for someone to clone it, replicate it?
Ooh, super easy. As easy as you can make it.
There you go. Thank you very much. Thermal under your armpit. And with mobile technology. Thank you, Dave.